now. Okay.
Just to add, Denise, she's having issues trying to connect.
Oh, is she? Okay. Maybe we'll, hopefully she can join us when she can then. Okay. Thank you for letting me know. Again, you know, the benefit of recording as well is if people can't get into the session, they can go back and watch the recording as well. So just a little bit of housekeeping then before we get into the session today. If you do have a headset or earphones or earbuds or anything like that, do plug in when you can. It just gives you and it gives everybody else a better experience really from an audio perspective. But if you don't have those to hand, don't worry too much about that. If you do have a lot of background noise, do feel free to turn your mic off when you're not talking, or keep your mic on if it's nice and quiet. Just I'll let you manage that in your own time. But if there's lots of noise in the background, do feel free to mute, and I'll show you how to do all these things in a minute. Oh, that's Jess coming back in now. So again, the session's being recorded as mentioned, so you can go back and watch the session should you like or when you want. And what we're going to do is going to be a highly interactive session today. So we're going to be using things like the chat box, the participants box, and the annotation tools. So it's not going to be a session of me talking to you for the next 3 hours, because that would just be really boring. But it's going to be a session where I'm going to get you guys to really interact and participate. And one of the ways you can do that is using the chat box. So at the bottom of your screen, you'll see a toolbar, and one item on the toolbar is the chat item. It's like a little speech bubble you can see that looks very similar to the one on my screen. If you click on that, that brings up a box which says Zoom chat. Just make sure your chat is selected to everyone so everybody can see the messages, and just give me a little hello in the chat for me. Just give me a little hello so I can see that you've got your chat open there. Thanks, Steve, that's great. Thanks, Deborah. Yes, Dawn, lovely, fantastic. Just give me a little hello. Let's have a hello from everybody if that's okay, so I can see you've got that. Thanks, Sarah.
I'm on my phone. Would this still be on my phone?
Oh, okay. So yeah, that didn't show up. Are you able to log in on your laptop, Julie?
I haven't got access to my emails on my work laptop.
Okay. I think you'll have slightly different functionality then from a phone perspective, which is why we ask people to log in on the laptop and the PC. But see how you get on, because some of the functionality that I'll talk people through today won't be what you see on your phone.
Okay.
But we can still interact.
In the meantime, I'll try and log on to my personal laptop.
Perfect. That's great. Thank you. Lovely. Thanks very much. Okay, good. So that's our chat option, and what we'll be doing is I'll be asking you some questions. I'll be asking your thoughts and your feedback and your input into the session today. And there's a couple of ways that you can respond. You can respond by keeping your mic open and talking, or you can pop your thoughts in the chat box. There will be specific times when I ask you to use the chat box for various reasons. So do try and use the chat box as we go through, and any thoughts, feelings, anything you want to share in the chat box as we go through the session, please do that as well. The toolbar at the bottom will also give you a participants box. So if you click on that, that's the icon with the two little people, and you'll see a list of names of everybody in the session. If you haven't renamed already, do make sure you have done that, but it looks like everybody has, which is fantastic. But what this gives us in particular is a way to interact as well online, using the emoticons at the bottom of the chat box. So you'll see there's a green tick for yes, a red cross for no. This is feedback for me as the facilitator. So if I'm going too fast, you can click on go slower, or if you want to move things forward, you can click on go faster. You've also got a little hand up on the left-hand side that you could use if you've got a question. So Steve's just popped his hand up now. Have you got a question, Steve?
Sorry to interrupt. Have you got the meeting ID? Denise is asking for it.
Yes. That link should have taken us straight through. Hang on 2 seconds. Okay. Yeah, so have you got a pen there?
Yeah, go ahead.
815 6420
Yep.
9548, and I'll give you the passcode as well. 575 572.
So 815-6420-9548-575-572.
That's correct. Yeah, that's it. Brilliant.
Thank you.
Thank you. Thank you. There we go. So let's go back to that. So yeah, so you'll see there you can put your hand up if you do have a question, and if you're on mute, or you can unmute and ask any questions. Also click on this box here, the more box. That gives you other emoticons as well. So you'll see there's things like a thumbs up, a thumbs down, there's a clap, there's a cup of coffee, and there's a clock as well. So if you do turn your camera off at any point and you're away from your screen, then put your cup of coffee up, because then I can see that you're away from your screen without having your camera on as well. So you can communicate digitally through the participants box in the session. There'll be times when I ask you to give me a green tick in the participants box, and that's me just checking in with you to make sure that you're with me. If you've got any questions, you're happy to move on. So if that's okay for everybody, give me a green tick in the participants box. There we go, lovely. And we've just got Julie swapping over from the phone to the laptop, so that is fab. Okay, so one more functionality that we're going to be using is the annotation toolbar. This is a separate toolbar that you can bring up that allows you to draw and text, or there's Denise coming in now, brilliant. Draw and text on the screen. So we're going to be writing our thoughts about things. I'm going to be asking you to share some of your reflections. I'm going to be asking you to do some group work, and we'll be using the annotation tool to do that. So the way that you access the annotation tool.
I'm so sorry.
Hi Denise, don't worry.
Hi.
Are you okay?
I'm good, thank you. How are you?
Yeah, I'm really good, thank you. I'm really good. I'll catch you up in just a sec.
Thank you.
Thank you.
Hi.
So to access your annotate toolbar, what I need you to do is just hover your mouse to the top of your screen, and you'll get a floating green drop down that looks very similar to the one on my screen. Next to that, you've got an option, a button that says options, and it has a little drop down. So just hover your mouse to the top of your screen, green drop down, options, click the little arrow, and it gives you this box here. And this box here, your third option down, click on that. That gives you the annotation toolbar, which looks very similar to this one here. Oh, Deborah, do you want to pop yourself on mute? We can just hear some background noise. Thank you. So what you can do here is just clicking on any of these, you can integrate, and you can write on the slide, you can draw on the slide, you can type on the slide, you can do whatever you want really. So has everybody got the annotate toolbar up?
No, not a minute.
That's okay.
By the slide, do you mean the video feed?
Yeah, so what you're looking at the moment on your screen, absolutely. So when you've clicked on any of these, just have a draw on the screen for me. There we go, fantastic. Or have a type. You've got stamps. You've got different ways of interacting. There we go. We've got lots going on there. Fantastic. Oh, Julie, I'm just putting you on mute. Oh, hang on. I've got some, I can hear some feedback. There we go, it's Julie. Julie's in twice now, so I've just popped you on mute. Okay, so there you go. Fantastic. Thanks very much. You can see everything there. You can engage. Deborah, you keep clicking on remote control. I'm going to decline that. We're looking at the annotate toolbar at the moment. So that's the one that you just get at the top.
Sorry, what am I clicking on?
So if you scroll, hover your mouse to the top of the screen, I just want you to have, if you got this green drop down here.
Yeah.
And then the options.
Yeah, I've got the options.
And you've clicked on annotate, and you've got this toolbar here.
Yeah, I've got all of it.
Perfect. That's great. Thank you very much. That's lovely. Okay, so is everybody...
Sorry, I haven't got it on mine, but somebody'd come in the office at the same time as you was explaining it.
That's okay. So just hover your mouse to the top of the screen.
Yeah.
You'll see this green drop down, a floating green drop down will pop down.
No, nothing at the moment. I've got the view options drop down box on the top, which has got Zoom, hide video, and request remote control.
Have you got annotate?
Yeah, there we are. Got annotate.
There you go, perfect. And that'll bring up that toolbar here. And then that gives you the options to text, draw, stamp, arrow, erase, etc., which is all the lovely annotations that we can see on the screen right now.
Oh, fantastic. Thank you.
Thank you. Fab.
Hi.
Any other? Yep.
Sorry. I don't know if I've got that function on the. I'm on my tablet. I haven't got access to anything else. Will that not?
Yeah, so you won't have this functionality on the tablet, which is why we need you to log in on the laptop or a PC. If you can't do that, don't worry, we can interact in other ways as we go through.
Okay, sorry.
If you do have so do you not have options to a PC or a laptop at the moment?
No.
Okay, no problem. Okay, so yeah, so you won't have the action to be able to annotate on the screen as we go through, but what we can do, it's Sarah, isn't it?
Yeah.
Yeah, what you can do, Sarah, is if we do some stuff on the screen, I can ask you to pop your thoughts in the chat and we can pop it on the screen for you.
Okay, thanks.
Thank you. Okay, so what you can do then is you see all these lovely annotations that you popped on the screen for me. You've got a little dustbin on your annotate toolbar. What I can do is I can click on this little dustbin, or you guys can do this as well, and it gets rid of all of the annotates on the screen. There you go. You can see that it's all gone there. And the reason we do that is if we move on to the next slide, the annotates stay on the screen. They don't go away with the slide. So I'll always ask you to just clear down your annotations as we go through. The nice thing about Zoom is it gives you a really easy save option. So there might be some slides that you have in the session today that you might want to take a photo of, and or take a print screen that your laptop will be able to do that for you. So if there's anything you want to take a copy of, what you can do is just click on save, and then it gives you an option that says show in folder. And you can take effectively a print screen of what's on the screen at that point. So you're very welcome to do that as well. Julie, I've got 2 Julies logged in, so can you log off the phone for me? Just leave the session on your phone and stay on your laptop, or else we'll get feedback from both devices. If you've got any questions or queries, do pop it in the chat. I've just muted you now because we'll get some feedback. Okay, so yeah, a formal welcome. Again, my name's Erica Farmer. If you've got any questions or queries today, do let me know. I'm down in the West Country with my 2 little pugs, Pepper and Daisy. 20 years corporate learning experience and working in various organisations. So I'll be with you for the next hours, 3 hours up until 1 o'clock. Just some advice to get us going. It's a really interactive session, as we've talked about. So we've covered all of the functionality that we will be using, and we'll also be using breakout rooms as well, where I put you into slightly different virtual rooms. So brilliant. Thanks, Julie. Julie, you can just unmute yourself now as well if you like. You can mute, excuse me, you can mute and unmute just by using the toolbar at the bottom of your Zoom toolbar. So the left-hand side gives you the mute, unmute, and it gives you the camera on, camera off as well. So it's really good to engage by having your cameras on if you can. It's fantastic to see your faces. Do try and minimize any distractions if you can, although I appreciate some of you are probably working at home. You might have kids around and pets and stuff like that, so that's fine. Don't worry too much about that. Respect any confidentiality, so we might get into conversations about things today. Please try and not mention any names. If you're sharing any kind of experiences, please feel free, like you can do that, but just be aware that there's other people in the session. We're recording the session as well. And if you have any background applications running, like email or any systems or anything, it's definitely worth turning them off, because they'll start affecting your experience and also be distracting as well. So our objectives for the session today, this is a breakaway session today that's focusing on things like violence and aggression. So we're going to be explaining communication skills that can help de-escalate in those kind of situations. We're going to look at the environment and sometimes how that can present some risks. We're going to have an awareness of what personal safety means and the factor that can influence that within your own personal safety in your environment. We're going to look at the factors which could influence your personal safety. And we're going to explain the communication skills that can help in a violent or aggressive situation. What we're also going to do is we're going to look at the employee and employer responsibilities when it comes to health and safety, particularly legislation. We're going to look at the legal and ethical issues associated with the management of violence and aggression. And we're going to discuss cultural and gender issues and violence and aggression. Now, following the session today, there will be a practical piece for you to do where you effectively practice and demonstrate the breakaway techniques. We obviously can't do that in the virtual world at the moment, but what I do have is some videos for you to watch just to get a feel for what they might be and what they look like. And you might have gone through this kind of training before, so do share your own experiences. But what I'd like you to think about is, you know, what's happening in the videos and what does that mean to you? And then particularly you'll have that follow-up practical session that your line manager will let you know about. So if you're okay with all of that, go back to your participants panel. So you might need to close down your annotation toolbar for now with a little red cross on the right hand side. Bring up your participants panel on the toolbar on the bottom and just give me a green tick. Just give me a green tick so I know you're okay with all of that so far. Perfect. Thank you very much. So let's get you guys really engaged and invested in this then. So I've told you a bit about me, but I'd like you to tell me a bit about yourself and just kind of a line or two about who are you, what's the role that you have in the organisation, and then we'll look at objectives for the session. But just give me a couple of lines, who you are, your role and where you're located in the session, where you're located at the moment. So if that's okay with everybody, Steve, can I come to you for your introduction?
Hi, I'm Steve. I work at Desu in Treforest. I'm a retinal photographer. I was a retinal grader. Before that, I worked in security, and before that, I was a police officer. I got a degree in photojournalism, and I'm sick of the lockdown and everything's good.
People are getting itchy feet now, aren't they? Thank you, Steve. Appreciate that. That's an interesting background as well. So you can add a lot to this from being an ex-police officer. So that's fantastic.
I've had a rather indecisive and fidgety career, you could say.
Fidgety, I like the way that you described that. Brilliant. Thank you very much. That's great. Denise, would you mind going next for us? So just unmute yourself and just let us know who you are.
Hi, can you hear me?
I can hear you, absolutely.
Hi. I'm Denise. I'm the senior screener for diabetic eye screening in Treforest. So yeah, before that I was a retinal photographer. Before that I was a lab manager for a film development company. And then before that I was a photographer.
Oh, fantastic. Okay, that's really interesting. So again, that photography background, which is interesting, right? Yeah, thanks. Thanks very much.
Okay.
Deborah, over to you, if that's okay.
Hi, yeah. So my name is Debbie, and I work for Desu as well in Treforest. I'm a healthcare assistant, and I worked on Cardiff and Vale Nurse Bank for I don't know how many years. And before that, I worked on emergency admissions in Prince Charles, and I've also done nurse bank work throughout the south of Wales.
Brilliant.
So,
thank you. And do you prefer Debbie to Deborah?
Yeah, I answer to anything.
Is Deborah kind of Sunday name?
That's when I've been naughty, that is.
Yeah, that's naughty name. Yeah, Deborah. Thanks, Debbie. That's great. And I don't think we've got Sarah join the session yet, have we? Not. I've got Sarah Berry, but I don't have Sarah Watkins yet, I don't think. So, okay. Just running down my list. So, Sarah Berry, over to you, if that's okay.
Hi, yeah. I'm Sarah Berry. I just recently started as a HCA with Treforest. Prior to that, I was working in Hamnacoid in Landock as a healthcare worker. Prior to that, I worked for Ludlow Street Healthcare, and I worked in across a number of their venues. I worked with autism in T. Corton, and crikey, can't remember the name of the place now. Beechwood College, sorry. And then I worked in community house with mainly personality disorder, borderline personality disorder. I've also, before that, I've worked during when they were shutting down Hensel and a lot of Acre Grange, bringing oh, good grief, helping people reintegrate back into the community. So
Wow.
I've got quite a varied, and I've worked in Bregenda and Pencoe colleges as learning support as well. So.
Brilliant. So again, quite an interesting background there. Brilliant. Thank you. No, thanks, Sarah. That's great. Thanks very much. Lots going on there. Thank you. Okay, over to Jess, if that's okay.
I'm Jess. I'm based in Carmarthen as the senior retinal screener. I was a retinal photographer before this. Before this job, I worked in Sainsbury's after doing my photojournalism degree, not really knowing what I wanted to do. Wanted to be a midwife, but then this job came up, so here I am.
Okay. Here you are. We fall into things, don't we? Thanks, Jess. That's great. And Julie?
Hi, I'm Julie Devlin. I'm based in Carmarthen as well. I recently just joined the services, so in the middle of lockdown. Prior to this, I'm not trained, but I'm going to be a retinal photographer. But prior to that, I was with Howard Dda NHS doing OCT technician, so in the outpatient clinics. And then that was for a couple of years. And prior to that, so for 25 years before that, I was a makeup artist and account manager for the beauty companies.
Oh, fabulous. Again, a really nice varied background as well. Thank you very much, Julie. That's brilliant. And Richard, over to you.
Well, hello. My name's Richard. I work here for diabetic eye screening in Carmarthen as well. I'm a healthcare assistant. And yeah, I've worked for the NHS approximately about just over 7.5 years in different roles. I'm new to this service. And previous before that, I've done many jobs. The longest job I did before working for the NHS was I used to sell aircraft space for Lufthansa. Yeah, German Airlines. This is many years ago. Started out in air cargo, and then I worked up through that. There you go. And I left in 2000.
Brilliant, thank you. It sounds really interesting.
People say that. The thing is, it's the same where people used to say to me, I bet it must be absolutely fascinating working at the airport, and you kind of get used to it. And what you see people on the sides of the roads with their cameras photographing all the planes coming in and that, and you just want to get away from it. But the one thing that always impressed me, even though I worked to the airport for years, the most thing that impressed me is when I used to go down by British Airways around where the cargo terminal was, and they had all the 747s which were on parks before, and the road goes underneath the tails, so you can just drive along.
I see.
About 20 or 30 aircraft tails, and it's
wow.
Really, yeah, that always I thought that was quite awesome.
Yeah, that sounds pretty cool. Brilliant.
Okay.
Thank you. Thanks, Richard. And we don't have Clive joining us, so that leaves us with Dawn.
Hi, I'm Dawn. I'm a healthcare assistant. I've just started at the Wrexham base. I used to do this in 2014. I left, so I used to do this job before. Did it for 7 years, and then I left to go travelling. Travelled South America for 7 months.
Wow.
And then came back and did domiciliary care then for a few years, and then moved from Bangor to Wrexham, and then this job came up, so I thought I'd go back.
Go back to what you know.
Yeah.
Oh, very nice. Traveling around South America. Wow, that sounds amazing.
Yeah, it was. Yeah.
Yeah, I can imagine. Amazing. Thank you very much, guys. Appreciate that. Now we know who. And do you guys know each other? Have you met before? Or is this the first time some of you guys have met, or?
First time some of us have met, obviously.
Yeah.
So.
Yeah, so it's being new. Some of you guys are quite new to the service and stuff. So.
Yeah, I think like some of us know each other, and some of us are, it's the first time of meeting each other on here.
Okay.
We're so spread out.
Yeah, seen us with our lockdown haircuts and everything. It's quite embarrassing.
It's long enough to tie up now.
Yeah. I've had no trouble whatsoever maintaining my hair.
Brilliant, fantastic. You might notice on the list of names there's a second Erica. That's me logged in as well. So what I do is I log in as a host, but I also log in as a participant, so I can make sure that I can see what you guys are seeing and I'm sharing the right things as well. So if you do see a second Erica, that's me as well. So thank you so much for your engagement and your introductions. What I'd like to get from you now is, what are your objectives for the session today? So what would you like to get out of this session? So what I'd like you to do is, I'd like you to go back to the top of your screen and get your annotation tool for me again. So remember, you had the green drop down, the options, and then the annotate, and it brought up that toolbar. And what I'm going to ask you to do is I'm going to ask you to write your name in one of these boxes on the left hand side, and then I'd like you just to write what your objective, what would you like to get out of this morning's session. And you can give me a couple of words, you can give me a sentence, it's entirely up to you really. But just have a think about it, pop your name on the left hand side, and on the right hand side just give me a couple of words or a sentence of your objective for today. Sarah, you might... Yes?
Can I use the chat?
Yeah, do you want to, I was going to say, Sarah, do you want to pop yours in the chat and then I can pop it on the board for you?
Okay, sorry.
Thank you. No, it's all right, don't worry.
Yeah, just say, do we have to pen this in with this artistic pen?
So you've got a T, you've got a text option. So click on the T, and that's you can type. Yeah, no problem at all. There we go. Denise has got it. Yeah, so use your text option for this one. And you can change colour if you want. So you can click on the format box, gives you another drop down, and you can change a different colour if you want to. Yeah, it'd be a bit difficult with the draw tool on this one, I think. There we go. So we've got a few names that have popped up already. And if you're in the same box as someone else, don't worry, I can move it around as well.
Okay.
If you're finding it's not popped up, what you can do is just click off and it pops up on the screen. So Deborah, I'm just going to move you down there. And then Sarah, I'm going to pop you in there. Have a think, take your time. We're not in a rush. Thanks, Sarah, that's fab. I'm just popping yours in there.
Should I be seeing what other people are writing?
You should see what's on the screen, but nobody's written anything yet, other than what I've popped in for Sarah at the bottom. So if you click off, yeah, so if you're typing and you haven't seen what you've written yet, if you just click away, it'll pop up. There we go. Here we go. We've got some stuff going on here. Thanks, Deborah. Debbie. Thanks, Julie. Thanks, Dawn. Brilliant, we've got some good stuff popping up. So
I can't
Denise,
see my name anywhere on
there. Steve, have you written your name on the left-hand side for me?
Oh no, sorry, I'll do that now.
And then if you do that and then click away, it'll pop up. So Denise says to get a better understanding of violence and aggression and to tick this ESR learning box. Apologies, I don't know what ESR is. Denise, do you want to tell me what that is?
Sorry, it's the learning platform that the NHS. Sorry.
That's all right, don't worry. That's fine. I had to guess it was a module or something, so thank you. That's helpful. Okay, Dawn says confidence to work as a lone worker in a small team. Yeah, absolutely. So we'll definitely think about, you know, how we work in it, you know, with people. What does that mean in terms of how we communicate? Are we working on our own and looking after ourselves? Richard says there's an update. Yeah, that's fair enough. Deborah says update on violence and aggression. Jules says good understanding of violence and aggression. Jess says refresh my knowledge and learn techniques to give me confidence in my role. Steve says ESR compliance. And Sarah says I'd hope to refresh my skills. Thank you very much, guys. That's brilliant. So what I can do, I can take a little screenshot of that actually. And what I can do is I can share that with you, and you know, you don't need to download this. You can download this if you want, but I can do a little screenshot and I can pop that in the chat. So what you'll notice is there'll be a little document that pops up in the chat, and you can download that for your own records should you wish. You don't need to if you don't want to, but there's just a little record there should you wish. So click on it, it'll come through in a minute. Just click on download, and you can download that into your system. So thank you, everybody. Appreciate you pulling up your objectives. We'll visit those at the end of the session. So as we go into the session, there'll be 3 of these slides. So you'll see 3 slides that have got sticky notes. And what I'd like you to do is just, when we get to these slides, I'd like you to reflect on what we've covered so far. And I'd like you to just write, what are you going to do differently? Or what are your key learning objectives or your key learns that you've learnt in the session so far? So we'll build a little action plan as we go through the session. And we'll do that using the text tool again that we've just used on the previous slide. So let's get going into the content then. So I've got a little quiz for you. I'm going to bring up a list of questions, and in the chat box, I'd like you to put fact or fiction based on the statement that I bring up on the screen. So it's literally just type fact or type fiction when the statement comes up. So just pop it in the chat box. So our first statement is, less than 2% of workers will face verbal and or physical abuse this year. And this is from the ONS. Less than 2%. What do you think? Fact or fiction? Pop your thoughts in the chat box. Okay, fact, fiction, false, fiction, fiction. Fact or fiction? We've got a bit of a split group. Interesting. The ONS tells us that's actually fact. Now, that's quite surprising because it's quite a low number, isn't it? So why do you think, from a data perspective, that's actually fact, telling us less than 2%?
People don't report it.
Yeah.
Spot on, Julie. Absolutely true. So we know, and like most of you guys have said there, actually, fiction, we know that a lot more abuse, particularly with what's going on around masks and stuff like that at the moment, there'll be a huge amount of people that have verbal and physical abuse thrown at them or experience that, but they won't report it. So this is done on reported figures, what we know. Men and women have equal risk of violence at work. Fact or fiction? Fiction, we've got fiction, fiction. And don't go with what everybody goes through. If you think it's a difference, then do let me know. Yeah, most people have said fiction. Absolutely. Who do you think out of those 2 genders experiences more violence at work?
Women.
Women.
Yeah, absolutely it is. And that tends to be more verbal abuse rather than physical abuse. Men tend to experience more physical abuse, but the numbers are lower. Yeah, Steve says women, absolutely. Again, no huge surprises on that one. So yeah, that is absolutely fiction. How about this one? More attacks take place after daylight hours. What do you think, fact or fiction? More attacks take place after daylight hours.
Steve should know this one.
Are we specifically talking about in the workplace?
Yes. Fiction, fiction, fiction. Yeah, mostly so. Interestingly, the data tells us that's a fact. Again, why do you think that's showing as a fact?
Is it because of alcohol or things like that? And
there's a lot to do with alcohol, absolutely. People coming into hospitals tend to be more aggressive if they're jacked up. on
Yeah.
whatever
So-
they're using.
Yeah.
Also possibility because it being at night, it'd be less witnesses if they commit to something, possibly.
Yeah, Richard, I think you're right. And I think the other one as well is people are typically so busy during the day as well. Maybe it goes back to that reporting piece. Actually, I'll just let it slide. There's some of that as well. So yeah, interesting. But again, this is based on reported data. We know there's a huge amount of stuff that happens that isn't reported. And violence at work is decreasing rapidly. Fiction. Interestingly, yeah, Julie, you're right. It's true, fact, because with there's more training, and I would say these figures are pre-lockdown figures. I think they might be, or this data is pre-lockdown. So actually, I think things might be slightly different at the moment. But yeah, actually, from a training perspective, from a security perspective, and you tend to hear what's reported in the news. You tend to hear the bad news, but actually, if you look at the data, it is decreasing rapidly. So that's good news, but we know that it still happens. We still know that there's violence at work, there's aggression. What's the difference between the two? When do we report it? When do we not report it? So yeah, some interesting information here. And what we're talking about here is personal safety. We're talking about you looking after your personal safety to limit the risk of any violence or aggression in the workplace. So what I'm keen to understand now is, what's your definition of personal safety? So just get your annotation tool for me again and pop your name on the left-hand side and just give me a definition of what personal safety means to you. So just find your annotation tool, click on your text tool, which is your T, and start typing on the screen for me. And Sarah, if you want to pop something in the chat, I'll pop it on the screen for you.
Okay.
Okay, Jules, Jess, I'm just moving you down to that one. Debbie, I'm just moving you down. Oh, Steve got there first. Steve, just moving you down to that one. And Denise, brilliant, thank you. And I'll pop Sarah at the bottom there. So just give me your definition of what personal safety means to you. Okay, we've got a few starting to pop up here. Love that.
Oops.
Don't worry, I can move stuff around if there's any whoopses. Thanks, Debbie, that's a good one. Okay, let's pop Sarah's in. Oh, lovely. Oh, I like that, Jess. Being able to do my job without fear and having training to keep myself safe. Yeah, that's a great one. So Richard says protecting oneself from risk. Yep. Dawn says feeling safe, having backup or procedures in place. Debbie says personal safety is a way of lowering or avoiding violence and a safe working environment. Steve says assessing the risk and working conditions in order to maintain a safe working environment and PPE. Denise says feeling safe in any situation. And Sarah says not feeling threatened, either verbally intimidated or physically threatened. And Jules says feeling safe and confident in my role with any conflict. Yeah, I think there's some really good stuff in there, and I'm just going to, again, just take a quick snapshot of that and just pop that into the chat for you to download if that's something you'd like to do. Again, you don't need to do that, but it's there if you want. I think you're right in all of your descriptors there, all of your definitions of personal safety, and I think we have a right to feel safe at work. But we all know when we're working in different environments, we're doing different tasks and working with other people, there's always a risk to that. And it's not always the people who are the risk, it could be the task. So you could be doing a job that has a risk to your personal safety, or you could be in an environment that poses a risk to your personal safety. So it's not always about other people, but it's worth considering sometimes in terms of violence and aggression, it normally is. So we're going to do a little bit of an exercise now. I'm going to break you into different rooms. I'm going to break you into 2 groups. And I'd like you to discuss and come up with your list of top 10 jobs that you think are at risk in the workplace, the risk to personal safety in the workplace. Okay, so I'm going to split you into 2 groups. I'm going to give you 10 minutes to come up with your list, and then we'll put that against the ONS data and see what we've come up with. Is that okay for everybody? Yeah, everyone all right with that? Yeah, okay.
Yeah.
So speak to me, it's okay. So in room 1, I've got Deborah or Debbie,
Yeah.
Jess, Julie and Richard. And in room 2, I've got Dawn, Denise, Sarah and Steve. So Debbie, I'd like you to be my team leader for group 1, if that's okay. And I've just picked you because your name's at the top of the list. Don't worry. All I need to do is write down your top 10 lists, your top 10 jobs in your list.
Yeah.
And Dawn, I'm going to ask you to be my team leader for group number 2, if that's okay. So again, I just need you to capture what your list of roles or jobs are that are at risk in the workplace. And what I'll do is, when we come back, I'll ask you to brief back those list of jobs and talk about why you came up with those jobs and why the list, so why is number 1 at number 1 and number 10 at number 10, for example.
Okay.
And Dawn, you do the same for group number 2. Is that all right for everybody?
Yeah.
Yeah. So if you haven't been in a Zoom breakout room before, what's about to happen is you'll get a little invitation pop up on your screen. And Julie, you'll get this on your phone as well. And it'll ask you to select or kind of agree. And then you'll get an arrow that pops up and it will be moving you into another virtual room. It'll then pop up. You'll see your group's videos pop up. So the people that are in your subgroup. And once you kind of get settled into it, then come up with your list of names. I'll pop into the breakout room just to make sure you've got everything you need and it's going okay. And then in 10 minutes time, I'll bring you back into the main room.
Okay.
Any questions on any of that before we get started?
Nope.
No.
No? Okay, so we're now at 10:46. So what I'll do is I'll bring you back into the main room at 10:56. Yeah, so just before 11. Actually, I'll give you till 11, so we've got a little bit longer. We've got 14 minutes for this, and then what we'll do is we'll take a quick break. So here we go.
Join.
Welcome back.
Hi.
Do you both have your lists of top 10 jobs?
Sort of.
Yeah, ours is sort of as well.
Okay, so it's 11 o'clock. Let's take 5 minutes for a leg stretch and a cup of coffee and whatever. Dawn and Debbie, you might just want to shuffle your lists or be kind of consolidate if you want to, because we'll come back at 5 minutes past 11 and then we'll go through the lists if that's okay.
Yep.
Perfect. Okay. Feel free to turn your cameras off and your audio off during the 5 minutes break, and I'll see you at 11:05.
Okay.
Thank
Thank you.
Thank you.
What was about 8?
If you are back, do feel free to pop your camera on so I can see that you're there. Thanks, Denise.
Hi, yeah.
Hey, Debbie.
Oh, that sort of like 10-15 minutes went really quick, didn't it?
It does. It goes so fast. Yeah, really. Yeah, and normally I'd give you less than that. I normally give you 10 minutes. I give you 14 minutes. So yeah.
And I couldn't write fast enough. I was like, oh.
Like herding cats, isn't it?
So it's surprising because we come up with quite a lot of job descriptions.
Yeah.
But it was trying to sort of put them all into like one category, because some of them, you know, would come, I would say, in the same position on the list.
Okay.
So that was a bit of fun, sort of trying to.
I'm going to get you to score them in a minute as well against my data. That's going to be even more fun.
Oh God. That is going to be fun then.
And Dawn, how did you find it with your group?
Yeah, I think we kind of did the same. We've put like a category rather than an actual job, I think.
Interesting. Okay, let's see how we get on then. Just waiting on Sarah and Jess, but I think we'll get going. So, Debbie, would you like to share from number 10 through to number 1?
Okay.
What you guys came, so give me your least risky first through to your most risky.
We've put bouncers.
Yeah.
Because 9 times out of 10, somebody, you know, bouncers are quite big butch people, aren't they? And you'd think twice about messing with them, really, wouldn't you? So,
okay.
And for number 9, we've got rail and bus staff, drivers, because even though they are at risk, 9 times out of 10, people just go on, pay for their tickets and away they go, even though you do get like the odd drunk or, you know, that would create a bit of a stink for whatever reason.
Yep.
Then we've got at number 8, retail staff.
Okay, yep.
Because like, yeah, they do put up with a lot of nonsense off people, you know.
Yeah.
After that, then we've got number 7 as cabin crew.
Yeah.
We got airport staff before that for number 6, which would, you know, people being frustrated about not having their passports and taking it out on the staff. On cabin crew can sometimes take the aftermath of that. So for number 5, we've got social workers and teachers. Basically, like social workers still have to put up with a lot of grief off people, you know, like they go and pay visits to people's houses and things like that. Teachers put up with a lot of abuse, sometimes verbally from either unruly children or children with behavioural problems sometimes.
Yeah. So have you grouped those two together?
Yeah.
Okay, that's interesting. Okay, yeah. Number 4.
So number 4, we've got GPs and pharmacy staff. So they are sort of grouped together as well.
Yeah.
You know, pharmacy staff still have to put up with you know, like prescriptions are not done properly. Sometimes people can get a little bit irate because of that. Or when you go into a GP surgery, you can't get an appointment, or somebody's turned up at the wrong time, they're frustrated.
Yep.
And then for number 3, then we've got frontline NHS staff.
Yeah.
Which we've got A&E staff. We've put like at the top end of that because of all the drunks, drug addicts, and maybe frustrated relatives. And paramedics, obviously, because they're first on the scene generally. And from experience working on the wards, I know that we get a lot of violent and aggressive patients, which need security to come up to.
Yeah.
Number 2, we've got police.
Yeah.
Well, obviously their job is high risk, so for doing the type of job they do anyway. And at number 1, we got traffic wardens.
Ah, I like that.
Yeah. For obvious reasons.
Because everybody loves the traffic warden.
Yeah.
Oh, yes.
Lovely. So traffic wardens, police, frontline staff, GPs, pharmacy, social workers, teachers, airport staff, cabin crew, retail staff, rail and bus staff, bouncers.
Yeah.
Lovely. Thank
problem.
you, Debbie. That's great. Dawn, from 10 to number 1 for your team, please.
Okay, so at number 10, we've got Department Health and Social Security. So, like Sarah said, people that work in job centres and
Yeah.
that help with money issues. Then at 9, we've got politicians or people in the public eye that get trolled online or maybe get abused in the street, thrown eggs at or whatever.
Yeah.
At number 8, we've got traffic wardens. Number 7, public transport. So we put taxi and bus drivers, just in general public transport, really.
Yeah.
6, hospitality and retail. So
Yeah.
bar staff and retail as well. Number 5, security staff, bouncers. Number 4, mental health crisis workers. Number 3, teachers. And then we've got police at number 2. And then we've put healthcare in general, really, at number 1, paramedics and A&E, registered nurses.
Yeah. Okay. So number 10, job centre staff. Number 9, politicians. Number 8, traffic wardens. 7 is public transport staff. 6 is retail and hospitality. 5 is security. 4 is mental health support staff. 3 is teachers. 2 is police. 1 healthcare.
Yeah.
Great. Thank you very much. How did you find that exercise as a group, out to the group?
Hard.
I think like it made us really think about the jobs that people actually do and how vulnerable people are in general.
Yeah. It's a lot of jobs.
Yeah. You know, and it's for, I mean, I can only speak from past experience of working on medical admissions and having violent patients on the ward, but we did have other staff around us to help out as and when needed, and security, whereas paramedics haven't got that. So, you know, it makes you think outside the box, really, doesn't it?
It does. Yeah, and I think you'll be surprised at some of these that start to pop up. So this data is a little bit out of date. It's about 3 years out of date. So won't consider, you know, the rising tensions of COVID and everything that we've gone through over the last 6 months and things like that. But just have a look at some of the ones that pop up from the ONS data.
Yeah.
So let's have a look. Oh, and by the way, if one of the ones that you've popped on your list comes up, give yourself 1 point as a team. If one of the ones pops up that you've put on your list and it's in the same place as my list, give yourself 2 points. Okay? So if you guys want to score your lists, as it were. So let's have a look. So what we've got in the data, number 10, home visitors. So anybody like social workers, mental health workers, people going into people's homes, absolutely spot on. You know, obviously quite a high risk environment there. They tend to be on their own. You can think about this also as a lone worker perspective as well. So if you're working on your own somewhere, just be aware of that. Number 9, shop staff. I think you both came up with retail, hospitality type staff.
Yeah.
Absolutely. So give yourself a score for that as a team. It's a bit of a crazy one. Vickers.
That's okay.
Why do you think Vickers is on that list?
Oh.
I suppose when you think about it, it's all religious belief and a lot of, what's the word I'm looking for? Not racism, but along that lines towards religious beliefs.
Yeah.
Yeah, I think there's part of that. Where do vicars tend to be? What kind of, think about their working environment?
Grief, you mean?
Say again, sorry.
Dealing with grief.
Grieving people, absolutely. Where else? I missed that, sorry.
Hospitals?
Yeah, so in hospitals as well, so there's a risk there. Where else do vicars typically be?
in the church by themselves.
Absolutely, absolutely. You know, and churches typically tend to be, you know, or can be a bit of a magnet if you're feeling stressed, if you need somewhere to sleep, if perhaps you're not in the right mental state. So yeah, so Vickers is on that list. Interesting, right?
Yeah, that makes sense.
Bus drivers and train staff. I think you both came up with public transport, so well done.
Yeah.
Another crazy left field one coming up. Librarians. Why do you think librarians might be on the list?
It's got to be the late fees. I hated paying those.
And you know, it's a minimal risk potentially on the great scheme of things, but there's a high risk, absolutely. Particularly, you tend to get people who tell people to shush. You know, you get told off for your late books, you're paying your late fees. So yeah, actually a high level of risk is reported against, or abuse is reported against librarians. Interesting, isn't it?
They've probably got low tolerance and report it a lot as well.
Yeah, you can imagine that actually, couldn't you? That's a bit of a sweeping statement, but I think you're probably right. Next one, we've got a bit of a gender piece on there. Think of it as firefighters rather than firemen. But yeah, exactly.
Yeah.
Emergency services. Again, your paramedics have come up. I think you guys both mentioned, you know, first on the scene. You know, you hear of these horrible stories of, you know, paramedics being attacked on scene or things being thrown at the ambulances. I mean, it's just hideous, isn't it, to think about it? So people who are there to save lives.
Sorry.
We did have like firemen and paramedics and the frontline staff. So does that make any difference to our scoring?
I don't know. You score yourself. See what your conscience tells you. Because we've got teachers coming up, which I think both of you guys got as well. I know Dawn's team, you said teachers.
Yeah.
Yeah, okay. And then well done, Dawn's team, for this one. Job centre staff, benefits advice people. Absolutely, very high risk. In particular, you know, you're talking about people's, whether they can eat sometimes, can't you? If the benefits are suspended, if they haven't gone for interviews, you can get into quite difficult conversations. So very high risk role as well. And
Sorry, Posty.
Say again?
Sorry, it was the postman.
Yeah, postmen aren't on there actually. Yeah, but interesting. Yeah, well, yeah, interesting. Yeah, definitely. And number one, you won't be surprised to see this.
Yeah.
Our poor nurses, who do, as you guys well know, take a lot of flack from not just people who've been drinking or on drugs or whatever, but you know, people in all sorts of mental states and different physical states, and you know, gosh, it's difficult to think of, really, isn't it? So yeah, so that's, like I said, the data's slightly out of date, but it kind of gives you a bit of a feel for risk in the workplace and what that means. So if you guys can just add up your points to see what you got and what order you got them on. There is no prizes for winning, unfortunately. I can't send you anything through the screen. It's just the pride of winning the exercise.
But we got, for number one, we got like emergency and medical staff. Does that count as nurses? Because we included nurses and ward staff.
Yeah, if you want to give yourself a point for that, you're welcome to. Okay, so Debbie's team, what's your score?
Well, we scored 7, but because of obviously we included firemen and paramedics.
Yeah.
You know, so because that was mentioned, so we scored 7 on that. So it would have been 1 point for each.
Yeah, and then maybe you get an extra point if it's in the right place compared to the place that's on the slide as well. And Dawn,
yeah, unfortunately we weren't that lucky.
Oh, okay, so 7 points for Debbie's team. Dawn?
I counted 10.
Oh, okay, fantastic, well done. So Dawn's team, well done, brilliant. Like I said, there's no prizes for winning, just the pride that you were in the winning team. But interesting to think about, you know, risk is not in those just normal typical responses and places that we think it would be. It can come from people, it can come from environment, it can come from task as well. Think about the Vickers being on
Out of
their own.
interest, is there a specific reason why police wasn't on there at all?
Oh, that's a great question. And bouncers as well. Notice bouncers aren't on there. Why do you think that's the case?
Well, we discussed in our group proportionality, like they've got the equipment and stuff to deal with it and the training, but it's still very risky.
Yeah, yeah. I think you're right, because if you think about police are there to diffuse a situation rather than deal with the situation, and they do end up dealing with the situation, but actually those diffusion training techniques are often what mitigate a lot of the risk in a lot of situations. And same with bouncers as well. But yeah, you could argue that they would be a high risk occupation, couldn't you? So thank you everybody for that interesting and enlightening exercise. What I'm now going to ask you to think about is, so now we've talked about from risk, we're going to go from violence at work and what that particularly means. So I'd like you to think about what are the costs of violence at work. So what happens if something happens in your workplace, and we know it takes the toll on various different things, and not just from a financial perspective, but also from a health perspective, a confidence perspective, etc., etc. So grab your text tool for me. So that's your annotate toolbar. Get your text tool out for me. And holistically, I'd like you to think about what are the costs of violence at work, either personal, organizational, etc., etc. So just have a little think and pop something down on the sticky notes for me. And again, Sarah, if you want to pop it in the chat, I can pop it in for you. Just have a little think and pop something on one of the sticky notes. Okay, that's the good stuff popping up here now. Well, so I've got some good stuff on there. I'll start moving stuff around in a sec. Don't worry if you're typing over each other, I can move it around. Okay. Yeah, lots of good stuff popping up here. And let's pop Sarah's up as well. Yeah, lots of really good stuff. Thank you so much. So we've got things like injury. Yeah, absolutely. So that's personal injury to you, to people around you, which leads to time off work. Cognitive impairment. Richard, tell me about that cognitive impairment.
Well, I'm talking about actually when the person actually breaks down. In some cases, especially if it's severe violence, the people actually become very mentally impaired and become affected themselves, the victims, and it's a knock-on effect. So it does form some form of cognitive impairment.
Yeah, brilliant. Thank you. Yeah, really great stuff. Thank you very much.
No problem.
Lack of confidence from abuse, yeah, you become fearful of that. Mental health issues, self-confidence issues, home life is affected, yeah, absolutely. Occupational health, yeah. Steve, tell me about that. Oh, you're on mute, Steve.
Sorry, I forgot I was on mute. The occupational health department have to deal with the aftermath of incidents like that, like counselling and things like that. Obviously, that costs money, so there's a financial implications.
Absolutely.
Again, it's like with long-term sick as well. It takes frontline staff away from where they should be, so there's that cost. You have to provide cover and things like that.
Yeah. Thank you very much. Yeah, definitely. Long term, you talked about there, for example, changes made to reduce similar incidents. Yeah, so putting things in place like training, maybe physical barriers, whatever it might be. Cost to the state. Richard says as well, if jobs lost, yeah, definitely. Long-term damage and affect mental well-being. Denise says, yeah, there's a lot of the mental impact that we don't always see straight away. Possible unemployment. Long-term sickness, change of career even, you might not feel comfortable in that role anymore. I think that's a really good one. Reduction in public trust, loss of income, ongoing staff sickness, Jess says, brilliant, yeah. Loss of confidence, fear of working, therapy, yeah, absolutely linking into the occ health piece. Physical injuries that can prevent you, doing your job or living your life to the full going forwards. Staff sickness, absolutely. Cost a company, they have to employ more people because people are off sick during these things. This leads up to millions and millions of pounds, doesn't it? So yeah, absolutely. So why does it happen? Why do we get this violence and aggression in the workplace? Why does it happen?
I think there's loads of different reasons why it could happen. Depends on the situation and the area in which you work.
Yep.
For argument's sake, outpatients could be somebody hasn't received their appointment, they're frustrated, take it out on the staff. Paramedics would be due to injury, or possibly patients were confused due to dementia, issues like that, or substance misuse. The list goes on, doesn't it?
It does.
Airport staff if they haven't got the right documentation. Like Steve was saying earlier about the police, you notice now and again you see police that are on their own dealing with situations. Could be due to cutbacks in departments. There's no end of reasons.
Like cutbacks in mental health is a big issue.
Yeah, absolutely. Yeah, definitely. And again, I don't want to make this about COVID, but we know that, everything's heightened, hasn't it, over the last 6 months? And, from a physical abuse, a mental abuse, some of these helplines, particularly in Devon and Cornwall, the office of the governors in Devon and Cornwall will report that there's been something like a 56% increase in the number of phone calls to some of the helplines over the last 6 months compared to previous. I mean, that's a huge, that's people being abused at home or being abused at work or whatever it might be. So it just goes on, and back to the point earlier, it's not always reported. So that's why it's so important to always report. Because if people know something about it, then perhaps they can do something about it. If they don't know something about it, then all of this stuff here we've captured, but actually we could probably make that bigger and bigger and bigger in terms of a figure, whatever that figure would be, somewhere in the billions, I expect, if we had to put a number on all of this stuff. Because again, a lot of it goes unreported, which is kind of just a key point to think about, and encourage people, if they have experience violence and aggression, either at home or in the workplaces, to report it. Because again, there's nothing.
I do think frustration is a massive one. I think sometimes it's lack of communication, and the lack of they don't feel in control. Either because the situations haven't been explained to them, or so much of what turns into a violent situation is down to communication and just frustration for not feeling as if that person's been listened to, or things have been explained to them.
Yeah.
And obviously not, you know, once you start adding drugs or alcohol into the mix, then that alters. But yeah, I think a lot of the time, if you can just buy time to slow the situation down and, you know, explain things, you can de-escalate.
Yeah, I agree. Absolutely agree. And we'll be looking at things like body language later and diffusion techniques, because that prevention's better than cure, isn't it? I think that's a really good point. Thank you so much for sharing that, Sarah. Okay, thank you. Thank you very much. So let's move on. And what we're going to start thinking about is what the legislation is that's in place to support us. And I've got a couple of questions that are going to pop up on the screen for you, a couple of polls. And we can think about, and I don't want you to think you need to memorize these acts, because you don't, but just be aware of what's available from a legal perspective and a protection, and what your responsibilities are as an employee when it comes to health and safety and things like that, and what are your employer's responsibilities are. So you're going to have some questions that pop up on the screen, a bit of a poll, and I'd like you to select the answer that you think is right, one answer per question, and submit your answer, and you'll see it all available on your screen in a second. And then what we're going to do is look at the legislation that supports what that means. Okay, so let's bring up our first question. So this is our first poll. Here you go. It's going to pop up on the screen any second. She says. There we go. Okay. Do companies have to ensure the health and safety of its employees? Yes, no, unsure, or probably. What do you think? Select the answer and click on submit. Okay, brilliant. 9 out of 9 people have answered. So let's share those results. What did you say? Yes, 100% of you said companies have to ensure the health and safety of their employees. Do you know the name of the act that sits in terms of legislation? Anybody shout it out?
Health and Safety at Work Act.
Yeah, absolutely. Health and Safety at Work Act 1974. It should be the duty of every employer to ensure, so far as this reasonably practical, that's quite an important point, the health, safety and welfare of his employees. What do you think that so far as is reasonably practical piece means?
Reducing the risk.
Yeah.
Risk,
what else?
Workers have to have responsibility for what they're doing themselves as well.
Yeah.
So it's not all down to the employer, it's down to the employee as well.
Yeah, absolutely, exactly. So you have a responsibility as much as the employer has a responsibility. Okay, let's look at next question. Bring up question 2. What legislation is in place to state this? Oh, we've just done that, haven't we? Health and safety at workplace. Sorry, my question's come up, but you can answer that anyway. Absolutely. I've skipped across a bit quickly there. Yeah, Health and Safety Act at Work. Thank you. Okay. Let's bring the next question up. Next question. Do companies have to provide training to staff? Yes, no, sometimes, dependent on the role, or unsure. There we go, 9 out of 9, thank you. Yeah, you said. 7 people said yes, 2 people said dependent on the role. So let's have a look. Just close down your poll. Let's have a look. Yeah, under the Health and Safety at Work Act, it's the employer's responsibility to ensure that the employees receive such information, instruction, training and supervision as is necessary to ensure the health, safety and welfare of staff by ensuring staff are competent. What do you think as is necessary means?
Dependent on their role.
Dependent on the role.
Yeah, exactly. So you wouldn't need to train me in health and safety and looking out for my role if I was a paramedic, because it's not the role that I do. Absolutely. So yes, they have the responsibility as is necessary. So the minimum risk to my role is very small. I sit at home, I work at home, I work in front of a screen. So my risk might be to my eyes, to my back. So it might be more of a display screen equipment risk rather than a risk of physical violence and aggression that you guys might potentially have within that hospital environment.
So can I just confirm, what is the correct answer?
It's yes, as is necessary, dependent on the role.
So both are
Right.
correct.
Yeah, yeah, absolutely. So top line, yes, you would expect an employer to provide you training, but it has to be linked to the dependency of the role.
Yeah, I almost said dependent on the role, because you've got agencies, like for example, security agencies who employ door staff.
Yep.
They essentially, they don't give any training, they essentially just manage your pay.
Yeah. But there would be an expectation that that person's trained to a certain level of competence to be able to do that role. So their SIA DIL badge or something like that. Good shout. Okay. Let's have a look at our next question. Let's change the question. Okay, sorry, just move that. Next question, number 4. New poll. Are you protected if you use force to protect yourself? Are you protected under law if you use force to protect yourself? So someone's gone for you and you've used force. Yes, no, unsure, depends on the situation, depends on the person. Oh, now I can hear the cogs grinding a little bit.
That's a good question, actually.
Isn't it just?
You did say if you have to defend yourself, yeah?
Mm-hmm. Well, are you protected if you use force to protect yourself? So by default, you're protecting yourself rather than going for somebody.
Yeah, it's got to be reasonable force, isn't it?
Ah, now we're getting into it. Absolutely. So, oh, look at the split result on this. Yes, no, unsure, depends on the situation. I think you're not far off. You're getting there with this one. So this is when we get into the Criminal Law Act. Any person may use reasonable force, as you talked about, in self-defense. While the law imposes a duty on a potential victim to retreat and escape, it might not always be possible. So what's that saying is your first responsibility is to retreat and escape under the law, but you can use self-defense if it's reasonable. In this case, the use of force or restriction of liberty in self-defense is likely to be considered legitimate. So who remembers the Tony Martin case?
Yeah, the burglary.
Yeah. So the guy that shot the 2 guys when they came into the house, and he was jailed, and he argued reasonable force, and the court argued against him. So there was 2 people on his property. They'd visited him several times. He was struggling to sleep. You know, these guys had been in and nicked loads of stuff. I think they'd affected some of the animals and the crop. You know, he was really, really struggling. And one night they came in, he took his shotgun and he shot them both in the back. No, he shot one of them in the back, the other one got away. And the court argued that was not reasonable force. And it's such a controversial topic when you see what he went through versus what he did. But ultimately, under the Criminal Law Act, they read it as it was in excess of reasonable force. Because he ended up killing one of them, I think.
I think it was the fact it was in the back, though, isn't it? That they
That's
were
right.
in.
Because they were running out the door when he shot the gun. Yeah,
Well, I
that's
think
what got it.
Because it was the firearms crime as well. That's probably why they came down hard on it, because it means it would have people all over the country just shooting people.
Yeah,
yeah. So that's probably the reason why they came down hard on it. So,
yeah.
Was it before or after the gun ban? I can't remember now.
After the gun ban, I believe.
But I think he had firearms license because to
gun.
do with him being on the farm and shooting, birds and things like that.
Really, just the threat of the gun was enough to make them retreat, so he should have left it at that.
But it's classed as an offensive weapon, isn't it, Steve? So it would be, it's not unreasonable force.
But they would have been in a hard place to report him for pulling an arm on them because they'd have to explain what they were doing in his house.
Absolutely, exactly.
I mean, you could say it was definitely a disproportional response, but at the same
That's what they got him
time,
on. Yeah.
you don't know what, you know. I mean, you have to look at the thing as a whole, like how was his vision and things like that. You don't know his mental state of mind, because if he's been victimized by these people,
exactly.
It'd be interesting to like read about that case, and I might do that. But yes, it's never clear cut, really, is it?
It's never, ever, ever clear cut. Hence why I'm asking you slightly ambiguous questions, because it's never black and white.
But if you
I had, when I worked, one of the jobs I had in Marks and Spencer's when I was younger, we used to have we used to have people come in who grab and dash. And it was my first kind of like week there, someone grabbed and dashed on Queen Street, and before they kind of sealed off that little bit in the corner of Queen Street where Marks and Spencer's is, so the cars used to come up to where the door was, so they would grab and dash, but I legged it after them, managed to grab some of the items before they got into the car, and I got a bollocking for it.
Wow.
Should have let them just go.
I guess because the fear is for your own your own safety, isn't it? Yeah.
My instinct was to get the items back.
Yeah.
But I was the one that got a bollocking for it because I didn't just let it happen.
Yeah.
It's that.
Yeah. It was like that. Yeah. It was a case of don't put yourself at risk.
Exactly. Yeah.
And we know through our top 10 list that we looked at earlier that you guys are in an environment where there's roles that are in that top 10. And number one, you know, nursing, you know, we talked about NHS and frontline and all that stuff. You're dealing with these kind of people. So I think that's a really great point, Denise, you know, the kind of make sure you're okay, the clothes and whatever else can be replaced. Yeah, that's a really good ad. Thank you for sharing that. Okay.
I was just going to say, the weird thing is, if this gentleman had done this particular crime in the state, somewhere like the state of Florida in America,
he would have gone away with it.
Got away with it.
Yeah.
I had a friend of mine who was from Florida, and he said that he was told as a kid, his father was told that if he shoots someone, and even if they stagger out the door, they're to drag them by the heels back into the house.
And shoot them again. Because it is your constitutional right to protect
you. To bear arms, yeah.
And your property. So if someone comes into your property and attacks you, it is within your right to shoot them. Where the line is you can't invite someone into your home or your property and then shoot them. That's what get you.
Murder, yeah.
So you can't actually invite them in to do that. So it's that.
Yeah, a different world.
If they stagger out the door and they sort of on your front drive, they're saying that you could actually be done, and that's why they say you actually have. If they've broken it, it's actually.
They have to be on your land, not on the curb or the street.
Drag them back in. And they said you can do that. It's quite legal. So
aren't you glad that we don't live there?
Crazy.
Yeah, it's crazy. But is it culturally? It's very different in the States, isn't it, to how we perceive that? So, but thank you. It's a really good conversation. So, okay, I've got one last question for you around health and safety responsibility. So, give me your thoughts on your answer on this one. I'll just click launch on this and it will pop up on your screen, and I think we've probably covered it already, but it'd be good to get your thoughts on this. Okay. Do employees have any responsibility for their own health and safety? Yes, no, some, unsure. There we go, 9 out of 9. And yeah, you all said yes. You all said responsibility. So what responsibilities do you have? What does that mean?
Is someone dangerous?
Okay.
Yeah.
Try and avoid the situations.
Yeah.
Dynamic risk assessments.
Yeah. Risk assessment, certainly one of them. Yeah, avoidance. Remember we looked at before around you've got the obligation to flee as an initial response.
report any incidents?
Absolutely, reporting is key. Knowing your legislation in regards to not being able to parrot fashion this, but actually be aware that you've got a responsibility, again, under the Health and Safety Work Act, whilst at work, to take reasonable care of the health and safety. It says himself because that's what's in the law, himself, herself, and of other persons who may be affected by his acts or omissions at work. So what do we mean there? Give me an example of somebody could put someone else at risk by your own acts or omissions. What does that mean?
Checking safety conditions and everything for your patients.
Yeah.
And I think as well, stopping and thinking about your actions before, you know, you just jump in feet first. I think like thinking about your position in a room and like the people around you as well.
Yeah.
You can intervene to help protect other persons if you have to, if they're vulnerable, I suppose.
Yeah, as long as it's reasonable or practical reasonable. Yeah.
Yeah.
We've got a wasp in here.
Oh, okay. You might need to flee.
Reasonable force.
Yes,
use harsh language, that works.
So what happens if you're a lone worker? How does this apply? If you're on your own, or you're in a car somewhere, visiting a patient or whatever it might be, on your way home from work?
You should be telephoning. You should pre-book, let people know where you are each time, where you're going, how long you're going to be when you're coming back, and let them know when you are back or when you are coming back, I suppose.
Absolutely, Richard. Absolutely. You know, we call it a tracing system. Absolutely. So you've got a responsibility to make sure people know that you're okay. So remember the Susie Lamplugh case?
Susie Lamplugh.
Yeah, the estate agent, the lady who was receiving flowers, and you know, there was this guy that was looking outside the window and would stare at her and book appointments and never turn up, and you know, she'd get notes and all this kind of stuff. And then unfortunately she went to meet a Mr. Kapoor to show him a house, and she never came back. So there was no tracing system. There was nothing in the diary. There was just a name, Mr. Kapoor. There was no address. No one had any records because it was all paper-based back then. It wasn't computer-based. So I'm not trying to scare you in any way, but just be aware that if you are working in your own, just please make sure that somebody knows where you are.
But they never.
We've had the same. We've had the same.
They never found her.
Where we had to shut. We had to do a late clinic in one of our clinics up in Trevethin. Debs, remember that one?
Yes, I remember.
We had the responsibility, which we shouldn't have, of locking up the building.
Yeah.
And it's in a place where where it is, it's been known, someone's been killed there. There have been people who have been attacked there, and we had to lock up after a very, very dark day, just to lock up. We couldn't find the keys, and we called everyone in the office, and nobody picked up.
Oh gosh.
It was absolutely ridiculous.
Knowing the fact that there had actually been a murder across the road and their own staff have been assaulted, I had to leave Denise on her own there to travel halfway back to Treforest to try and get a set of keys. All because, well, there was nobody in our office, and it was pitch black there at the time, wasn't it, Denise?
Pitch black.
Yeah.
So,
did you raise that with your? Did you raise that with the organisation? Has something changed since?
We did. Now, after that, they always make sure anyone who's doing a clinic there, they contact someone to let them know when they reach place. But it comes to the point that we shouldn't be locking up that clinic in the first place because it's not our building.
Right.
So have that responsibility of locking up. They should have one of their staff there to lock up and make sure everything is okay.
So that's interesting. So think about, thank you for sharing that. And so think about, look at the screen, what you can see now, management, health and safety and work regulations. You know, it imposes a requirement on you, and it sounds like you've done this already, to bring to your employer's attention any situation or condition which the employee considers to be of serious danger or shortcomings to the employer's health and safety arrangement. So if you still haven't got what you need from that, I suggest that you raise that again, and you've got responsibility to do that under that legislation as well. Because that's not great that you're on your own knocking off stuff, especially if you're on your own. You don't want to be there.
Yeah.
but thank you for sharing that example. Okay. Right, we're going to come up to another break in a minute, but what I'd like you to do before we go to the break, I'd like you in the chat box just to think about and give me what are your definitions of violence and aggression, because they're slightly different and they're two slightly different things. So in the chat box, what are your definitions of violence and aggression? Have a think, and what do they mean? Okay. Injury and fear. Richard says, Richard, I'm taking that, you mean violence by that one. Yeah. Verbal and abuse, Jess says. Yeah, so tell me which one you're giving me a definition of. Are you giving me a definition of violence, or are you giving me a definition of aggression? Just pop that in the chat. And these are normally act-based things. It's an act of violence or an act of aggression. So what does that mean?
I spelled it right.
Don't worry about your spelling. Okay, Steve says applying physical force to someone or making them feel that it's physical force is about to happen to them. Violence, yeah.
Missed the letter.
Don't worry, I can see what you mean. Intimidation, yeah. Don't worry, don't worry. Sarah says violence involves a physical act. Aggression is a threat via body language or verb. Okay. Verbal abuse, Denise says. Physical abuse. Remember, there's all sorts of abuse as well, isn't there? What's violence mean and what does aggression mean? Just give you a couple last seconds to pop something in the chat if you've not done that already. Jess says violence, causing physical injury to a person or causing damage to the environment. Aggression, raising voice, verbal abuse, displaying anger. Yeah, I think they're all very valid. The ones I picked out in the dictionary: violence is an act of physical aggression to cause injury, damage, or even death. So it's the response of something. Steve says verbal abuse or intimidating body language, expression, raising voice, etc. is aggression. Yeah, so often violence is the end result of aggression. Aggression is defined as a behavior aimed at causing harm or pain, psychological harm, personal injury, or physical. So it's the intention with aggression, isn't it? It's the intention for violence, for something physical, usually for injury, damage, or even death. So let's, most people don't set out to harm others. I think we can kind of take that as a borderline, okay? We don't go to work with the intention to hurt other people. But it happens, we all feel aggressive sometimes, whether because we're frustrated or we're emotionally strained or we're driving or whatever, most people are aggressive or feel a level of aggression at some point in their life. But what are the reasons for that? Why do people get aggressive? Get your text tool out for me and pop your name in one of the boxes on the left and give me some reasons for aggression. Why do normally people that you might know and think that Erica, she'll never get aggressive. What are you talking about? She's a very placid person. Why might Erica become aggressive? Why might people become aggressive? Give me your reasons. And Sarah, just pop that in the chat for me. Don't worry, I can scoot you around. Jules, I'm just going to pop you down. Oh, Jess, I'm going to pop you down there. Dawn, I'm just going to pop you down there. Okay, yeah, got some stuff popping up here. Frustration and stress. Yeah, but think about the reason why. Why do people get frustrated? Why do people get aggressive? What's the reasons normally that this happens? Why are the reasons generally? some good stuff popping up here. Remember, you can change your text color if you want by clicking on format. You can keep the blue or you can change color. It's entirely up to you. Oh, there's a list of good stuff there from Steve. Brilliant. It just says pain. Debbie says aggression can be as a result of being late for or not having an appointment, response to a situation. Yeah, absolutely. Jules says stress at work, home life, other people's body language, response to somebody, people's attitude. Denise says frustration, financial issues. Yeah, that's a good one. Jess says lack of communication, personal family issues, health issues, money worries. Yeah, definitely the money bit. Remember we talked about the benefit officer earlier. I think that's a great one. Dawn says frustration and stress, sickness, feeling helpless. Oh, I love that, Dawn. I think that's a drive for a lot of people's aggression. Steve, frustration, mental conditions, environmental factors, injustice, behavior. Injustice, that's a big one, isn't it? How many times do we see that? Behavioral inhibitors, personal private issues, learning difficulties. And Sarah says feeling restricted, misunderstood, confused. Something's changed, it's not as expected without explanation. Gosh, that's good. Yeah. Lack of communication, I think, is a lot of this sometimes, isn't it? Brilliant, thank you. Okay, some really good stuff. There's a few other bits that have just popped up as well. Lack of food for people with a medical condition, losing personal items. Yeah, some really good stuff. I think there's a lot of stuff there that you've shared, which is really good. I'm just going to take another quick snip and pop that in the chat should you want to save that. It's entirely up to you. Losing a relative due to medical conditions. Yeah, all these poor people that, you know, have lost people over the COVID and not been able to be there. You know, it's just heartbreaking, isn't it? So
It's horrendous.
it is. You just can't imagine it.
It's going to have knock-on effect for such a long time, because grieving's a you know, terrible process, hard, long process anyway. But I got, you know, I can't even think how difficult it is when you haven't had that support. You haven't had all the normal coping strategies available to you. So it's awful. I feel so sorry for people.
And they do say there's a bit of a tidal wave of mental health problems on the way because of all this as well, don't they? So kind of definitely, I think this training and these conversations now more than ever are really important. So you guys are protected and you know what to do if something happens. Thank you. So yeah, I think you're right. And the only builds and adds that I've got is you can often group these, so things into, you know, personal, so a breach of an issue with confidence, breach of trust. If someone's not appreciated, someone's over challenged, they can become aggressive. If you breach people's values, personal, cultural, political, sometimes you hear these things worth dying for. You know, people's own values. We see this a lot in a religious context, in a political context. Absolutely, people become aggressive and violent there. Interest, resources, money, space, things and time. People often become aggressive over these things. If they don't have them, they can't get them, they're taken away from them. Again, think about Tony Martin. Instrumental, disagreements on goals, methods, structures and procedures. You see people often get aggressive for things like that, as well as everything that you've talked about so far. So we're now on 12 o'clock. We're just about to tip over to 12. Let's take 5 minutes. Again, feel free to turn your video off, turn your audio off, and let's come back at 12:05. Go and have a bit of a leg stretch, get yourself a cup of coffee, and I'll see you in 5 minutes.
Okay, thanks.
Okay, we are past 12:05. It's now 12:06. Oh, Richard, have you got a question? You got your hand up.
No, it's okay. It's
Oh,
fine.
okay. Brilliant. Thank you.
Sorry for being late.
Oh no, don't worry, you're fine. So we've got an hour left together, just under an hour, 54 minutes. We've got quite a lot to get through, and I want to make sure you guys see the videos as well. So we're going to be a bit pacey now for the next hour. So I just wanted to share with you the typical violent behaviour cycle. You've probably seen this before, and this is typically the journey that people go through. So this is where they go from aggression to violence and everything we've just been talking about. And we've talked about what those triggers are. Why do people become violent? You know, they can start to work themselves up, talk themselves into that escalation. You've seen it before. Get to that critical point where we go to the point of no return. That might be the physical point, where something's thrown, somebody puts a fist through a wall, somebody attacks somebody, that's that critical point. But then you then go into that recovery period of people start to realize what's happened, and actually that post-trauma depression space where people start to feel guilt perhaps of what they've done. Not everybody goes into that post-trauma depression space, but I'm sure you've seen this several times. So just shout out to me, what do you think the warning signs are of when people become agitated and become aggressive and start to kind of move up that journey we've just seen? What are the warning signs?
Body language.
Say again? Yep.
So I said raised voice.
Raised voice, absolutely. So they, the voice, the tone might start to get more sharp. It might start to get louder. Absolutely. What else?
Body language.
Yeah, so you might start to see
that.
Yeah, that aggressive body language. It might become a bit assertive. You might start to see the waggly finger. You might start to see people fluff up a little bit, peacock a little bit. That's when things are starting to escalate a little bit. What other signs?
They might move into your personal space a bit more, step forward towards you.
Yeah, absolutely. Might step forwards towards you. Absolutely. Yeah. One more.
Or pacing.
Oh yeah, pacing around almost like a bit of a lion in the cage. Yeah, I think that's a really important point as well. There's stuff going on for people's brain that you don't always recognize and you don't always see. And you might have seen this before. We've got that limbic system in our brain that starts to kind of pump that blood around our muscles, getting into that fight or flight response. Either we're going to run away from the threat, or we're going to fight the threat, or we might freeze. A lot of people freeze in the threat, but the higher brain starts to close down because the blood's needed for the muscles. So actually people's logical thinking, when they start to go on that violent behavior cycle that we've just looked at, people don't think properly. And you've seen this, you've seen people not perhaps verbalize properly, or say things which you think, what on earth are you going on about? Or become that kind of pumped up, violent, aggressive stance that you see from individuals. It's because of what's going on in the brain. Your higher brain closes down and your limbic system starts to go. And this is what else goes on. You start to become tunnel visioned in your view because your body, again, is getting ready for that fight or flight. Your breathing might start to increase. Your muscles start to tense up. And your liver starts to convert that glycogen to glucose, putting sugar in the muscles ready to fight or flight. Things like your heart starts to go. We've all been in that situation when your heart starts to pump. And it might not be because of you might think fight or flight because you feel a threat of something that's happening. You might have shaky hands in that space. So you can start to recognize there's things going on for that person that they can't control because the anger or the aggression is starting to gear them up for violence. That's exactly what happens. We have a brain response and we have a physical response. So again, this trigger piece is when we're going up. And your goal is to be as non-threatening as you can be. So listening, diffusing skills, not to kind of argue or fight at any point, because if you argue or fight, what happens at this point? Absolutely. You go even quicker into that escalation phase. It's like telling people to calm down when they're really frustrated. It just doesn't work. You know, so this is the area where we're starting to escalate. People are thinking, gosh, he's going to kick off here, or she's going to kick off. You can see it, you can see the stance, see the muscles start to go, the higher brain's closed down, and violence is about to occur. And then it occurs in this critical phase. Huge psychological state of arousal, they call it, even though you're not thinking properly. It's that red mist that takes over. Again, I'm sure you've seen this in people before. And at this point, all you should be thinking about is the safety of yourself and others. It's not about stopping people, it's about getting out of the way. And remember, we talked about this in the legislation. It's around, you've got the obligation to flee. Don't put your safety of yourself in the way of this person. Let them smash up the table, let them put the fist through the wall, whatever it's going to be, because, you know, otherwise that's going to be you if it's not going to be the table or the wall. If they do go for you, this is the breakaway stuff that we'll talk about in a minute. What can you do to get out of the way? What can you do to break that grip that they've got on your hair, on your clothes, on your neck, on your wrist, whatever that might be? And then they do go into recovery. And this can take up to 90 minutes, even a bit longer for people, but they will come back down towards that baseline behavior. But just be careful. It's so easy just to trigger that off again at this point, get them back into that critical phase. So just let them calm down and be really clear in your instructions. Because remember, the higher brain still hasn't woken up properly. We're still in that limbic system. We're still in that fight or flight. We haven't got back down to that baseline behavior. So don't overanalyze, don't try and get them to explain their actions or anything like this at this point, because, you know, you could trigger something off very quickly if you're not careful. You've all been there, you've seen it. Go on.
Sorry to interrupt. I suppose in this case, I suppose it's people who are not in control of their emotions. It's usually emotions that take over. They call it something like the monkey paradox or something.
Absolutely, yes, absolutely. It's the chimp brain. Yeah. It's that limbic system, the animalistic part of the brain that just kicks off. Yeah.
You can't tame it, but you have to try and live with it.
And, you know, that's why some people have cognitive behavioral therapy and things like that, to reduce that monkey in the brain, that chimp paradox. So they're not kind of either from an anxiety piece or an anger piece or a depression piece. You know, this is the brain reacting in this emotional way. Yeah, it's a great point. For some people, you will see guilt and shame. For some people, you won't. So you might get this person come back the next day, offer to, I don't know, fix the hole in the wall that they've done, or offer to apologize, or whatever you might see, you know, relieving their own guilt because they're back down to that baseline behavior. The brain's woken up, they've reflected on their actions. Some people won't. They won't. You know, it's horses for courses. Everybody's different. So that's that violence behavior cycle. But do you know what? An ounce of prevention is worth more than a pound of cure. So we want to prevent these things as much as we can possibly do. Remember those diffusion techniques we talked about, the bouncers and the police, the reduced risk of being able to manage these things. So this is a really interesting piece of research that talks about the message that we all give off. Dr. Albert Morabian was a professor that looked at how people communicated and analysed what we take from messages. And if you think of a message being 100%, Morabian's rule talks about 55% of that message is the body language. It's what you're saying with your body in a face-to-face environment. 38% of that is the vocal language, so the tone, the emphasis, the pauses, how I'm really emphasizing certain words, and only 7% is the words that I say. So let me give you an example. If I came into the room, say we're in a room right now, and I came in and I said, okay, can everybody get up, please? The house is on fire, we need to leave. Rather than, guys, we need to leave, we need to get out right now. You know, I'm saying the same words, but it's the emphasis, it's the body language, it's how I'm coming across. So body language plays far more into a message than what we initially think. And I appreciate the virtual world is slightly different with that at the moment, but you've already talked about the importance of body language prior and how that can trigger off that aggression, and then how that could go into that violent behaviour cycle that we've talked about before. So I want us to think about body language in this context. Get your text tool out for me and give me some examples of some really helpful, conducive body language in this experience. So you've got someone on that violent behaviour cycle, you're starting to see the triggers happened, it's starting to accelerate. Give me some conducive, helpful body language and some not very conducive, not very helpful body language. And Sarah, if you want to pop that, any thoughts in the chat and I'll pop it out for you.
Yeah.
Brilliant. Brilliant. I haven't given you a little box for your name this time, have I? Okay, so interesting stuff coming up. If you want me to move things around, I can do. So I'm thinking, Rich, you probably need that one over there, do you?
Yeah.
Yeah.
Negative ones now.
That's fine. And I'm going to move hands and hips. Where's Deborah? Oh, I can't see your name, Deborah. I'm going to pop that over there. Jules, I'm going to pop you over there. Conducive versus not conducive. Helpful versus not helpful. Oh, Steve, that's a good one. Good word, proxemics, yeah. We talked about personal space earlier, didn't we? That's good. Oh, Debbie, I'm going to pop you just over there. Personal space, Denise says, yeah. I'll pop you up there, Denise. Some good stuff popping up now. You're going to be Zoom whizzes after this. All over it with Zoom. Brilliant. Grinding teeth, yeah. Yeah, mirroring, just leaning towards, definitely in the right context, absolutely. Yeah, Steve, absolutely. Okay, Sarah, brilliant. Let's pop Sarah's in the bottom. Keeps cutting me off when I do that. I don't know why it does that. Some really good stuff popping up here. Okay, let's do, just scoot that one over there. Scoot that one over there. Okay, so Rich says open palms held up in front. Yeah, do you know where that comes from?
I surrender.
Yeah, it comes from when we were in the Stone Age. Showing your palms meant you weren't holding any weapons. So that's a sign of, you know, I come in, I'm friendly, I don't have any weapons, I'm not hiding anything, I'm not holding anything. That's where that comes from. But on the non-conducive, crossed arms, raised voice. Yeah, I'm sorry, Mr. So-and-so, you can't act like that. Well, he's just going to kick off, isn't he? moving towards the person in their personal space, being aware of that. Absolutely. Denise says arms by your side or arms crossed. Yep. So probably, yeah, it could be comfortable, but just be aware of how that comes across. And invading someone's space, yeah, definitely. So I'll pop that in the non-conducive as well. Ignoring the individual, Rich says as well. Yeah, the last thing you want to do is ignore them, because they'll come straight after you, won't they? Dawn says positive and helpful eye contact, facial expression, smiling, nodding. Oh yes, Mrs. So-and-so, I understand what the issue is. Absolutely. Nice, sincere tone as well. But Dawn says actually non-conducive, turning or looking away, rolling eyes. Julie, I love that. I'm going to pop that in your bit there, but you're absolutely right. Rolling eyes, cutting across. Oh, it's just the worst. Excuse me, I was talking actually. You're going to listen to what I'm going to say. Absolutely. Remember, it just makes it worse, goes back up on that violent behavior cycle. Just as eye contact, leaning towards to show you're listening. Yeah. And actually being slightly further down, so not to the point where they're going to kick off, but actually I'm slightly submissive rather than standing over, allowing them to speak and not talking over. Absolutely. Jules says smile, open body language, but not hands on hips, not rolling eyes, and a bad attitude. Yeah, absolutely. Okay, Debbie says remain calm. Absolutely, with a calm voice, feet apart and ready to leave the room if you need, but don't be obvious about it. Be just subtle and understand what that means. Facial expressions, grinding teeth, yeah, tapping foot, yeah, and lack of eye contact. And Steve says proxemics. How close are you to that individual? But actually open hand gestures, access eye contact, so you're not staring at that person, you've not got that facial expression on. Yeah, and Sarah says eye contact but not staring. As the same level as them, not threatening, respectful personal space, slightly to the side, allowing an open exit for you. Absolutely. Don't stare, don't stand directly in front, as it can be read as confrontational. Absolutely. I think you're right on all of that. Let me just pop your last bit in there as well, Sarah. And you know, when we're starting to feel under threat and we're thinking, oh gosh, something's going to happen here, you know, our higher brain function starts to close down, because we're also going into fight or flight thinking, oh God, I'm going to have to, you know, run, something's going to happen, I'm feeling worried about this. You know, it's important to recognize that you're in that space as well, potentially. So just being hyper aware of what's going on is really important. So you've come up with some really good stuff there. So think not only about, you know, what you say, but how you say it. You know, you will start to go onto that violent behavior cycle yourself. You'll start to get wound up, especially if you tend to fight rather than flee. So be aware of that. Speak calmly and clearly. Super, super important. And of course, avoid patronization and sarcasm. And you think that's an obvious one, but actually in the moment, sometimes you don't realize what's being said and what you're saying and how you're saying things. So just be careful you're not triggering off that violent behavior cycle again in that post-traumatic piece. A nice little diffusion technique here is to plan, and we'll talk a bit more about planning in a minute. Prepare, look confident but not overconfident, avoid the risk that we've talked about, and never assume that you know what's going to happen. Be aware, as you know, you've been here yourself, there's lots of different things that could happen. You can't control that other person, you can only influence them with your own behavior. So it's nice, a nice little anagram, that, not anagram, what's the word? I can't remember now. But plan, if you think plan, prepare, confident, avoid the risk, never assume. It's about having options. And the more options you've got, the better. Because the less options you've got, you start to run out of time. So let's think about risk assessments. And you've already talked about this already. You'll be doing dynamic risk assessments in your organisation already. I'm sure you will. One of the ones I want to introduce to you, you might know this already, is a PET analysis. So a PET analysis is the people, who are the people I'm coming into contact with, my colleagues, my patients, the public, relations, whoever it might be. What's the environment that I'm working with? What can people grab? What can things get in the way? What can stop me fleeing? What can people use if they're on their violent, aggressive behavior cycle? And actually, what are the tasks that I'm doing in my job that put me at risk? So that's what I want you to think about. Let's do a very quick PET analysis in your role. Think about what are the risks that you need to consider with the people you're working with, the environment you're working in, and the tasks that you're doing. Just grab your text tool for me and just give me some words that you would need to think about if you were doing a PET analysis, a risk analysis of those three things.
Mine will be an assumption because I've never actually worked in this role before.
That's okay. Just think about what it could potentially, because this isn't, it is, I think it's an assumption anyway, because you're assuming things are going to happen and mitigating the risk against those happening.
Okay.
So yeah, so that's absolutely fine. Okay, some good stuff popping up here now. Okay, I'll just scoot them around. There's not a lot of room, so I'm just going to scoot you up quite close on some of this stuff. Some really good stuff on here. Let's think about the task as well. What else is going on with the task that you need to consider from a risk assessment perspective? Yeah, working in the dark, Jess, that's a good one. Yeah, lone working. Okay, lots of good stuff. Let me just pop this one up as well. Lots of good stuff there. Thank you very much. Lots of brilliant stuff there. I'm not going to go through all of it again. You can see what's on the screen there. And I think you'll be doing a lot of this as part of your organizational policies and procedures. You know, you've talked about, you know, dynamic risk assessment, always just scanning, being aware when you're on the wards, when you're with patients, you know, what else is going on, you know, what potentially could happen. And it's not about putting the fear of God into you. It's just about being aware, isn't it?
Sorry, I sort of did that wrong. I should have gone into the environment.
Oh, that's
you
okay.
know,
I can move it. I can
professional
pop it here.
environment.
That's fine. We're running out of space a little bit, so that's why I just chucked it there, to be honest.
No, sorry. I mean, I didn't risk assess the environment. I just sort of explained what I thought would be
Oh,
my
that's okay.
role. But
That's okay. It's just all I need you to do is start thinking around what that means. So don't worry at all. Yeah, brilliant. I think there's some good stuff in there that you guys have really thought about in terms of, you know, what does that mean, and just filtering it into, you know, that person, task, environment, or person, environment, task, just allows you to think about the different ways you can do that, and it allows you to think about, okay, so who are the people I'm working with, what's the environment I'm in, what are the tasks that I'm doing. So yeah, thank you. I've just taken a snip of that and I've popped that again in the chat, so you can download that if you'd like a copy of that as well. So I'm just going to ask you to do a bit of a summary exercise before we go into the the breakaway videos. Just give me your key learning points so far. We're in our last half an hour of the session. Just give me your key learning points so we can just capture what are you going to do differently? What have you taken away from the session so far?
Oh, the man.
And remember, if you're typing on the blue, you might want to change the color. What else have we covered so far? What's your key learning points so far? Plan, X-ray, run away.
Yeah, it's a good one, isn't it? If in doubt, just scream and shout.
Definitely the key learning point for sure is your own personal safety.
That's right.
Yeah.
That's right. Always be prepared. You never know. Never underestimate anybody. I learned this the hard way. You never underestimate the people who you least expect to give you a bad day are the ones that usually do give you a bad day, and the ones you usually perceive and you sort of look at them and think, oh God, you know, and they're actually really nice people.
Yeah.
And it's the ones you never think of, usually the ones that just, I don't know, they just seem to be the worst.
Yeah, I think there's definitely just having an awareness of what's going on around you. Like you said, not make an assumption that little old Doris in the corner or little old Pat in the corner, they're going to be fine.
Well, I've seen somebody like little old Doris run down a ward waving a great big broomstick, smashing things and chasing staff around.
Gosh,
So
wow.
this was a very little old Doris, and I tell you what, she was very strong. I was hiding in the treatment room, just looking out the window. I locked myself in the one place where they didn't have a telephone.
Oh,
So banging outside the door, and then she went, and I popped my head out. She had gone, she was smashing the computer up down the end of the ward. So
wow.
the one place that was secure didn't have any form of communication for help unless you open the window and scream down.
Well, yeah, and hopefully that's something that can be reported on and learnt from, because, you know, to have a phone in every room and things like that's normally pretty critical, isn't it?
This is different. This type. I'm talking about where previous places I've worked.
Okay.
Before, you know, but yeah, that's the one thing I was really surprised working on wards with things like the medication safe room, treatment room, as we call it. They never had any phone contact in there, but that was the one place which, if there in case of a problem, it's locked, it's lockable from inside as well. It's one place we usually flee to, so it's sort of like a safe room.
Right, got you.
Did you not have an emergency strip on the wall?
Yeah, they got emergency strips on the wall, but not usually in the treatment rooms, no. Not any treatment room I've worked in. They've never had anything. You know? That'd be great.
Wow. Thank you for that. I've just popped a copy of that in the chat again. I'm just aware of time. We've got about 23 minutes left, so I'd like us to go into force and the videos. So Thank you so much for that. That's okay. Thank you for sharing, Rich. That's really interesting. So let's think about force. So we've started to touch upon force already. So do remember, are you protected if you use force to protect yourselves? What do you think?
Yes.
What did we say earlier?
In the right situation.
Absolutely. Reasonable. It's got to be reasonable. So it replaces the common law rule about self-defense. There is a duty to retreat, but it's about reasonable circumstances. So this means you can protect yourself as long as it's reasonable, as long as it's not over the top. So what is reasonable?
Pushing away.
Yeah. If you were in front of a jury, the jury would assess that you've only done honestly and instinctively what you thought necessary. So yeah, pushing away, get away. If there's a grab, using a technique to get people off you. Yeah. Protecting yourself.
Self-defense, general self-defense, but just to get away. But if you dot the person down and decide to lay into them, as they say, then that's assault.
Absolutely, absolutely. That is not just enough to get away or get yourself out of that situation. So if you start, yeah, laying into them, like you said, that's, you know, you will be convicted in a court of law. If it's a relatively minor attack, and somebody talked about this earlier, it's Steve, you mentioned this, I think it's around proportion. So, you know, like you said, if someone, you know, does something to you, kind of grabs you, you can't turn around and then kind of kick them and punch them. You need to do what you can to make sure it's proportionate, which is what these breakaway techniques will show in a minute.
Yeah, proportionality and accountability as well. You have to be able to justify your action.
Absolutely, thank you. Absolutely. So let me show you some videos. We're now going to watch 3 videos which demonstrate breakaway techniques. And these are the things that you'll have further training and then asked to demonstrate when you're back in, fully back in, and your line manager will give you the update on this. But what I want to do today is just show you these 3 videos. And I want you to think about and just observe what's happening in the video. Take some notes, because I'm going to ask you to reflect after each video, just to start thinking around, because we can't physically do it at the moment, but what does that mean in terms of the stance? What does that mean in terms of what you can do if you're grabbed by the wrist, if you're grabbed by the hair, or if you're grabbed by the clothes, by your clothes, or if you're choke held? Hopefully this won't happen to you. This will never happen to you, but you never know. And we want to make sure that you're just considering these kind of things. So you're practicing, you know, good personal safety. You're aware of what's happening. Is that okay for everybody?
Yeah.
Yeah. So the videos are a couple of minutes each. They're not very long. They're from an instructor who's specifically trained in breakaway and disengagement techniques. So this isn't people going for people. This is purely those breakaway techniques. So make some notes, and I can make these videos available to you afterwards, and just have a think, and I'll get your reflections afterwards. The sound will come through your speakers or through your headset. Okay.
Yeah, you're in there. Okay, so looking at the wrist releases, the Breakaway, I've introduced, Philip Payne, Taekwondo Master, is going to help me with the demonstration today. So we're just going to be looking at wrist releases to start off, and this is the parallel wrist grab, and I'm just going to move a little bit closer to the camera and describe some of the theory. So the theory is that, in a sense, the finger and thumb, that's the weak place. If we can move even a bit closer, that's weak. Now, to me, it's good sense to think about what is the purpose for this person grabbing you. It may not be for violent reasons. It may be because they just want attention, or they're in pain or discomfort. They just want to draw attention. So don't always presume that. It might be an elderly person, but we need to work against this finger and thumb. All we can do to start with is just pushing off and saying, "Can you let go, please?" Okay? So he's just grabbing again, and all we're doing is just pushing him off nice and gently. So it's not a firm grab, it's the loosest you can. Yeah, imagine an elderly person's got all you. Come on, just let go, please. But because it's a breakaway, we need to step back. So we'll step back a little bit so you can see it clearer. So Phil grabs and just say, "Come on, Phil, don't worry. Just let go, please." Just push his arm away and move away nice and gently. I've got my hands here just in case I need to defend. Okay.
Okay. Don't presume that all the grabs are for aggressive reasons. I think he makes a nice point there around, someone wanting something from you. Ask the person to let go. The weak part is between the finger and the thumb. Push against while stepping away, exit the area. Okay. So just give me some thoughts and reflections on the notes that you made during that video, just to kind of embed some of that stuff. What was going through your mind? Give me your thoughts and reflections, either on the activity itself, what was going on for you there. Yeah, effective communication, definitely. See how he said, "Come on, let go, please." Speak to the person, not assume the worst, but be prepared for it. Remain calm, don't assume. Yeah. It's a really nice little technique just to push somebody off. Good, clear instruction. Gentle force. Yeah, Dawn, I think that's a really, really important point. Remember, we've talked about force. It's not over the top. It's proportionate to what's happened. Yeah. Break contact and move back, Rich says. Absolutely. Remember, he stepped away, didn't he? Remember, it's that weakest part between the finger and the thumb. That's what he was talking about, wasn't it? Because that's where they tend to grab. Yeah, so the arms pushed away, remain calm, gentle force. Yeah. Step back and hold palms up.
On mine, I've gone to type in pushed arm away a few times now, and it's not letting me finish. It's just put in pushed arm. So I was going to put on the pushed arm away, stood back, and then put hands ready for defense.
Okay, well, you can do that as separate ones if you want, if that's easier.
Yeah, for some reason you can see us. Let me put pushed arm twice on there, but nothing else.
Don't worry, it's fine. I know what you mean from there then.
Yeah, I have to do my sentence separately for some reason.
Yeah, it just keeps going off. We've done it a couple of times now.
And don't worry too much about continuity of sentences. If we can see what you mean, that's fine.
Okay.
Thank you, Sarah. I'm just popping yours on there as well.
Do that.
Brilliant. Some good stuff on there. Gentle force. I really like that, Dawn. I think that's a nice way of putting it. Okay, last couple of seconds on that one. That's a wrist grab, isn't it? Thank you very much. Okay, let me just pop that again into chat. Let's look at the next one. Okay, this is hair grab. Okay, so again, take notes, have a think about what does this mean? What if this was me, what would I do? How would I deal with this? What's he showing us in the video?
So now we're going to look at a hair grab, and we're just going to look at the hair grab from the front. That's all it is. So obviously somebody's grabbed hold of your hair. Now there's a few options with this. I mean, one is don't put yourself into this position. But two could be you just hold it and anchor it to your head, so you keep your elbows in. If we move nice and close, so you just anchor it. With your hands in this kind of way, your arms in this way, you're protecting against punches. So if Phil tries to punch me, at least we've got some protection there. And you're hoping that other colleagues can come and assist you. Now, on courses, I often say, well, if the free arm's there, maybe a colleague could take hold of that free arm as a distraction, and then others could really maybe try and untwine the fingers while you hold the hand firmly to your head. If you are totally on your own, there are a few options with this. This is more of a general services technique. But you slide up so your hands are over their hand, okay? You need to keep your elbows well tucked in because there's still the danger of punching. But you're taking a step backwards, okay? So you put a bit of duress on their wrist and then bringing them down to the floor. It's not as easy to demonstrate this, but so you're reaching, grabbing all of the hands, and you're stepping back and you're guiding them to the floor while you stand up yourself. We'll move a little bit closer so you can see the dynamics of it. So we're coming in, we're protecting. Rather than the wrists and just anchoring it this time, it's the top of the hand and just by stepping back. But you're having to step back yourself and you're bringing it down in this kind of manner. Last resort. I'm generally not a fan of things like this where you have to bend down because I think you're getting closer to knees, which is a danger. So my preference is if you can hold it, anchor it to your head. You've got alarms where you work, chances are in mental health units, you pull your alarm, you wait for the assistance of colleagues, you protect yourself the best way you can. Maybe even having to stand slightly side on so you can avoid a kick or whatever. But it's very much about awareness. Thank you for watching that.
Okay. Ask the person to let go. So again, we've got communication again, side stance if possible, both hands holding the hand, so you're anchoring it to the head. Stepping backwards, which is the dynamic piece, pushes the assailant's wrist down, move to an exit, or hope colleagues are supporting and coming to you if there's any emergency alarms, etc. So again, what was your reflections? Just quickly give me your reflections on that one as well.
Am I exempt from this one?
Maybe it could be beard.
Yeah. Extremely painful.
Mine's got a long way to go.
Again, Debbie says clear instruction, anchor to pull away. Yep. Raise the alarm if you can. Ask to let go, Jules. I think that's a good one. Don't panic, grab with 2 hands to the head and step back. It's funny because it's not a natural thing that you'd expect to do, is it? So don't escalate the situation like it's a self-defense class. Yeah, that's a good one, Denise. Move to the exit, Jules says.
Taught differently when you're taking self-defense classes than when you're working in an environment like that.
Yeah, it's a different thing, isn't it?
Mm.
Raise the alarm. Yeah. Technique and bow down. Yeah. Sarah, whenever you're ready, I'll pop yours in as well.
Okay.
Thank you. Well, that's a good one from Sarah that's just popped up as well. Press down on the arm, yeah. Entwine if there's long hair. I think that's a good one. Thank you very much. Again, taking a screen grab of that, popping that in the chat so you've got a copy of that one as well. And last but not least, our third video, our clothing grab.
We're going to move on to look at some of the clothing now. So you can present the clothing, particularly if it's in the training context. If it's a man and a woman working together, you present the part of clothing you want them to grab. Okay, and you hold the clothing to you. It just makes a lot of sense to anchor it, because otherwise, if you're knocking his arm away, he's got a tight grip, he might tear your clothing. It might happen anyways, regardless. Now, if we just move a little bit closer, so up to the screen, so you can see that Phil's got that there. A bit like we said with the wrist releases, it's the thumb and finger, it's that weakness, it's that gait that we need to work again. So if we've got the other hand and we're just pushing it away, okay, and we're stepping back. Show you one more time. So we've got the grab there. You're holding the material tightly to your body, you've got a hand, and you're just pushing away and stepping away. If we step back a little bit so you can see it's in its entirety, he grabs, okay, I hold the material, and I just push away and step away. It could be a collar grab, so you can present the clothing there if it's a single hand one, and again hold the material to the body. And remember, we're working against the thumb and finger. If we did it this way, it wouldn't be as effective. But this way, working against the thumb and finger, it's got more chance of being effective. So the hand comes up, and I want to emphasise, it isn't a slap or a strike or anything like that. It's just merely pushing it off while stepping yourself backwards. Okay? Okay, so we're still looking at clothing grabs. We just looked at a single clothing grab. But what happens if somebody gets hold of your lapels here in this kind of way? Now, because I have people from the NFPS courses and the General Services courses, I'll show you both varieties. The General Services one will be to turn here with your hands on the outside, and then you turn in your body. The key is that you need to step back, okay? So you're stepping back and pushing away. See it again? So the hands are coming up here, all right? And you're sweeping them across. Now, if I just didn't move, I'm trapping his hands there, and it's very difficult for him to move, okay? And I'm stepping back, okay? If it was a strangle, it becomes more important, because I'm lifting my hands up and doing this. All I'm doing is trapping his hand further against my neck, and I'm causing more damage to my neck. So it is absolutely imperative with this one that you must step back while you're doing it, okay? Other varieties of this, so the NFPS techniques would be, it could be a clothing grab, or let's move it to a strangle, is you just put two hands on his chest and you're pushing yourself back. It's about straightening your arms, okay?
I think we've frozen, have we, by the looks of it?
Yeah,
Okay, hang on.
Yeah, mine's frozen.
frozen as well.
So if you move a little bit, grab, so you can present the clothing there, if it's a single hand one, and again, hold the material to the body. And remember, we're working against the thumb and finger. If we did it this way.
See if I can kickstart it. Hang on,
Mine's stopping and starting.
Yeah, I don't know what's happened there. Let me just. Let's see if we can reboot.
It was intermittently moving, but it was freezing in large.
Let's try again.
Merely pushing it up while stepping yourself backwards. Okay? Okay, so we're still looking at clothing grabs. We just looked at a single clothing grab. But what happens if somebody gets hold of your lapels here in this kind of way? Now, because I have people from the NFPS courses and the General Services courses, I'll show you both varieties. The General Services one will be to turn here with your hands on the outside, and then you turn in your body. The key is that you need to step back, okay? So you're stepping back and pushing away. See it again? So the hands are coming up here, all right? And you're sweeping them across. Now, if I just didn't move, I'm trapping his hands there, and it's very difficult for him to move, okay? And I'm stepping back, okay? If it was a strangle, it becomes more important, because I'm lifting my hands up and doing this. All I'm doing is trapping his hand further against my neck, and I'm causing more damage to my neck. So it is absolutely imperative with this one that you must step back while you're doing it, okay? Other varieties of this, so the NFPS techniques would be, it could be a clothing grab, or let's move it to a strangle, is you just put two hands here and you put them on his chest and you're pushing yourself back. It's about straightening your arms, okay? So if you move a little bit closer, you can see a little bit more. So your hands come up through the middle, onto his chest, and you're pushing back. If we look from the back, we might be able to see how his hands part. So I'm not striking him, I'm just putting hands on the chest and I'm pushing back, okay? Now, a variety that I've come up with, and that is the NFPS technique that I've come up with, is, you know, maybe you're dealing with female patients, or, you know, but again, you're looking at a fairly serious situation. You can bring your hands up here, okay, and just push on the inside of the elbow there, so the elbow just bends a bit, but remembering you must step back with it, okay? So it's coming up, okay, you're turning to that inside part of the elbow and you're pushing it back and stepping away yourself.
Okay, again, ask the person to let go. One hand clothing, pushing, and remember, he talks about pushing away and stepping back, pushing away, stepping back. Work against the weak points. Strangle, step back. Again, step back. If there's something going on around your neck, step back to a safe difference and make sure you protect yourself. So we're just going to run slightly over just a couple of minutes, but I just want to get your reflections on that one as well, like you did before for me. Yep, stepping back, that's key, isn't it? Push away, step back. Push away, step back. Yeah, Steve says again, shout for help, of course. Yeah. Oh dear, we're nearly done.
It's all right. Sorry, didn't realise it. Forgot I had the camera going because I've got no videos up.
Okay, I'll just add Sarah's on there as well. Thank you. Okay, brilliant. Thank you very much. Let's just take a quick snapshot of that again. Pop that in the chat for you again. Okay, we're coming to the end of our session. We are slightly over, but what I'd like to do is just get your key takeaways from today. Oh, let me clear that actually before we do that. I'd like to, what are the key takeaways from today? I'll just come back. What are your 1 or 2 things that you're going to take away from the whole session today? Okay, breakaway techniques, Jess says, yep. Thanks, Sarah. I've got your second one there. Brilliant. Don't worry about popping your names on this one. Just give me your takeaways. You can if you want, but if you haven't already, don't worry. It's okay to leave rather than escalate. Yeah, definitely. Due respect for Vickers. Love that. Yeah, thanks, Jess. That's great. Let's get a key takeaway from everybody.
Deterrent.
Brilliant. Drugs and alcohol are bad, people suck. Okay, just give you the last couple of seconds for that. This for me is the key piece. Make yourself the priority. Make yourself safe as much as you can. Be aware of the risks. Be aware of what's going on. I think that's really important. Working environment, Sarah says, yeah, absolutely. Risk assess what's happening. Just look after yourself. And sometimes it's so easy, you get so caught up on things that it's easy to get distracted sometimes. Just give you the last couple of seconds. If in danger, scream and shout. Yeah, absolutely. Thank you, guys. Really appreciate that. So today, it's absolutely flown, hasn't it? That's 3 hours. We've understood and explained communication skills which can assist in de-escalating a violent, aggressive situation. We've had an awareness of the environment and the risks it may present. Have an awareness of personal safety, and we've described the factors which could influence your personal safety in the environment. We described the factors which could influence and affect your personal safety in the environment, and explained communication skills, particularly body language, that can assist in de-escalating or escalating a violent and aggressive situation. We talked about the violent behaviour cycle. We've looked at employee responsibilities in regards to health and safety, legal and ethical issues associated with the management of violence and aggression, culture and gender issues, in particular, our quiz, remember at the beginning, and you will get the opportunity to demonstrate and practice the practical use of breakaway techniques that you've seen in the videos today. Before we finish the session, is there any last questions? No? Has that been helpful? Has that been a good session? Has that been enjoyable?
Yeah, really good.
Yeah, it has.
Yeah.
Okay.
Yeah, thanks.
Yeah, thank you.
You're
Thank
very
you.
welcome, and thank you so much for your engagement and participation. That's what makes it, really. So thank you, guys. Stay safe, stay well. See you next time. Feel free to leave the session now. Thanks very much, guys.
Thank you.
Thanks,
Bye.
guys. Take
Bye.
care of yourself. See you next time. Take care.
Bye.